right now in this country, we have a system of care that's built on a really old adage, right? It's the build it and they will come. I'm Fady Barmada. I'm president and co-founder of Pivotal Analytics. So there's a really good story about that. I have a good friend right now that's going through treatment for cancer, right? And when he was first diagnosed, of course he's terrified, right? He's spoken to his primary care physician. He's getting a battery of tests. He's going to speak to another physician. Then he's going to get more tests. Literally, my friend spent days on the phone trying to figure out where to go next. He had to drive 45 minutes to an hour at times to get access to these places. Sometimes they would tell him that he needed to wait a month and a half before he would actually get some of these critical tests. And you have cancer, right? I mean, that's terrifying. There's no way he's gonna sit there and wait for a month and a half. Now, take that, my friend has resources, right? He's highly educated, he's highly health literate, he actually understands the system very, very well, and it was still that challenging for him, right? What provider-centric means, a system that is not built around people, means that it is very, very difficult to navigate, both for people who have means or are very, very, very health literate, and incredibly, nearly impossible to navigate if there are significant barriers. Pivotal is an intelligence platform that helps health organizations build better, more effective systems of care. And the way it does that is through enabling customer-centric decisions around who and what to put where. It's a map-based platform. We're the only platform in the market that actually maps locations, physicians, and the care services and resources they provide to their communities against a projection, a map really, of current and projected care needs for patients and their families across the United States. We map all of those gaps. We understand how people travel, where they need to travel to access that care, and we see there are lots of gaps in our system currently. Well, so systems are investing all of the time in new care products and services, really investing in physicians and making sure those physicians have what they need to care for their populations and are in the right place. We give them the perspective necessary to be in that right place. It's no longer, I've got 4 docs who are here, I'm gonna build them a center and then tell all of my patients, actually incentivize my primary care physicians to tell my patients to come to this. I'm gonna put them in a place where it's really easy for people to get access to that care. They've got the right capacity, the right products to really, really deliver the care that's needed for those populations. A system works at multiple levels. It works at an individual clinic, right? So if you walk in the door, where do you go next? Do you sit in an exam room? Do you talk to an individual as you check in? Do you turn left and there's 4 exam rooms right there, right? I mean, so that's really little to make sure that all those resources are there and that people are going through and getting the care that they need. In a hospital, does a hospital have enough exam rooms? Does it have enough operating rooms? Is it laid out in a way that makes sense, that people don't have to walk left and right? And then, right, like I was telling you the story before, if you need to access care across, meaning if you need to talk to a lot of different people, right, to your primary care physician, to a specialist, an oncology specialist, to a radiologist, are you driving here and there and there and there to get these services? Or can you go to one place? Can you go down the hall and talk to your primary care physician? Can you then go get direct referred to a specialist? Is it all in a place where you can get access to it, where we can compress that care journey into a place where, frankly, we're not wasting our providers' times and we're not wasting our customers' times? We've had a lot of success, actually. I mean, frankly, in the past, it's been really, really difficult to support these kinds of decisions because there's data here, there's data there, there's data there, there's data there. It's really hard to put it all together because, I mean, frankly, it's structured in a really, really difficult way, and you can't really figure out how to make it work together. That's really what's unique about our map-based platform. It's all about, look, if I know where people are and I know where the physicians are, then I can start layering data like behaviors of the individual communities, the care needs of those communities, the capabilities of those individual physicians in a single platform that ultimately tells them, okay, well, look, I've got a huge gap here. I've got a whole lot of people that are driving 45 minutes away, and there's a great opportunity for us to move some of the physicians that, aren't really super effective over here to where they're really needed. So there's a huge recognition in the marketplace right now that type of perspective is absolutely needed. So we've had a lot of success. We've had a lot of organizations that, leverage our platform to drive near-term decisions. And what's really, really exciting, we're an early company, right? So we've just sort of started that journey in solving those problems. And it's a very, very big initiative, right? There's a whole lot of data that we can potentially bring to the table, a whole lot of perspective that we can give up our customers and partners. And what's really exciting is every time we get into these conversations, they say, this is awesome, can you also do this? How about this? And we're there to figure out new ways to answer that question and say, yeah, absolutely. We'll find it. We'll bring you that perspective. And then together we'll discover how it ultimately helps you make better decisions around those customers. We just closed our Series A. It was $10.2 million. Like I said, we're really early, and our platform we're constantly looking for data assets and resources and new ways to use that data, because it's not just about bringing the data together. It's great and it's cool, but it's what you do with that data that's really important. It's how you actually change behaviors and re-engineer a system that's really important. So what that money gives us the ability to do, we've got a phenomenal foundation. We've got a whole lot of excitement. We've got a whole lot of partners that, like I said, are asking us about new and better perspectives, new and different ways to use the data. Now we can support them on those journey, right? We can actually hire the resources that we need to scale our ability to deliver that type of perspective and value to our customers, and we're moving very, very fast on doing that. So there's a couple. We love working with health systems, right? Health systems, you're the front lines. You are the ones that ultimately, one, provide care all the time. This is not what we do, right? So this is your industry. We're there to help you achieve that goal of driving care to the patients who need it. Our other ideal partners are the affiliated organizations that are there to help health systems achieve that goal, right? There are real estate developers, REITs, right? Instruments that have capability, expertise, and capital to help health systems realize a lot of these strategic goals in investing in resources to bring that care to their communities. We have, right now, we actually just partnered up with Carrot Health. They specialize in SDOH-based risk modeling and a really great understanding of health-centric behaviors. So not only are we really interested in partnering with the systems, payers, developers, right? Everybody that's involved in building that platform of care, we're also really interested in looking at new perspectives, new data resources and assets, and new partners to help us drive a lot of that perspective to our other partners, our channel partners. I'm most excited about working with a lot of our health partners right now, right? Because we're really now starting to see change. Each and every investment that we support right now is bringing new resources to communities that needed it before. What I really want to see, I want to go back to my earlier story, right? I don't want to hear those stories anymore. I don't want to be involved in those stories anymore. I want to see customers who, across the the socioeconomic spectrum, everybody needs care. Nobody, when they're in need, when they're scared, when they really desperately need help, nobody should have barriers in front of them to getting that help. So what I'm really excited to hearing about in 2022 is how we've been at the table to help health systems drive better, more efficient, more equitable care to the people who need it.